One of the most frequently asked questions is what's the difference between osteopaths, chiropractors and physiotherapists? In many ways, there are more differences within the three professions than between them. That is to say, one osteopath may be considerably different in their approach to another osteopath, and the same would apply for physiotherapists or chiropractors. However, there are some generalizations that apply. The difference between the professions is a bit like the difference between the three main political parties in the United Kingdom. Each has their own philosophies and origins. In the case of physiotherapy, it has evolved within the orthodox medical framework in the UK, whereas osteopathy evolved outside of this framework and had its origins in the USA in the late 19th century. Chiropractic sprang from osteopathy around the beginning of the 20th century. The current length of training in the UK is about the same for all three professions, at 4 to 5 years. When it comes to back pain, chiropractors tend to be more concerned about the precise alignment of vertebra and sometimes take X-rays to assist in their diagnosis. Osteopaths are concerned with alignment, but often place equal importance on the ease of motion of individual spinal segments and state of the soft tissues around the spine. Physiotherapists tend to be governed by set protocols for particular types of back problems. This then translates into the common approaches to treatment that are taken by the three professions. Chiropractors almost always include and often exclusively use direct manipulation of the spine, involving short, sharp thrusts that often produce a cracking sound as the joints of the spine are manipulated. Osteopaths regularly use these techniques, but will often use other techniques such as soft tissue massage and stretching. Some physiotherapists will use soft tissue techniques as part of their treatment and may use manipulation if they have taken postgraduate courses, which many in private practice have. But physiotherapists tend to make more use of electrotherapy, and their focus is a little more on remedial exercise and less on hands-on treatment. However, it must be emphasized these are generalizations. Length of treatments also vary. Osteopaths and physiotherapists commonly offer follow-up sessions of 30 minutes duration, whereas chiropractic treatment will commonly last 5 to 15 minutes. You may have come across the term cranial osteopathy. This refers to a particularly gentle osteopathic treatment technique that is often used on children and babies, although it can also be used on adults. The technique is similar to craniosacral therapy that may be used by other types of therapists. Some osteopaths use cranial techniques almost to the exclusion of other treatment techniques, and hence become known as cranial osteopaths. However, all osteopaths have undergone the same undergraduate training in spinal manipulation and soft tissue techniques. The term cranial osteopathy is also somewhat misleading, because the technique can be used on parts of the body other than the head, and there are many other types of osteopathic technique besides cranial that can be used on the head and neck area. You may also have heard the term McTimoney chiropractic. This refers to a particular branch of chiropractic treatment that uses a gentle flicking motion to treat the spine rather than direct manipulation or adjustments that involve clicking the joints.